Antidepressants Other by Katie, Kayln, Rachel, and Madi. Labs and tests needed with this class. For Wellbutrin, you need a CBC, liver function test, and/or urine test. For Remeron, you need a CBC and liver function test before and periodically during treatment. For Cerazone, you need a CBC and liver function test. For Eleptro, a CBC, liver function test, and/or urine test before and periodically during treatment. There may also be a slight insignificant decrease in leukocytes and neutrophils during treatment. For Deplin, you would need a CBC. Also note that patients at risk for or with vitamin B12 deficiency, pernicious anemia, should consult with their physician prior to taking this drug. Side effects. For Wellbutrin, common side effects are insomnia, inability to focus, constipation, diarrhea, dizziness, dry mouth, agitation, loss of appetite, and weight loss. Severe side effects are abnormal heart rate, low blood pressure, and high blood pressure. For Remeron, common side effects are drowsiness, increased appetite/weight gain, dizziness, and nausea. Severe side effects include hallucinations, fever, fast heart rate, confusion, and tremors. For Cerazone, common side effects include drowsiness, nausea, dry mouth, and constipation. Severe side effects include fainting, seizures, confusion, fever, chills, erection that is painful or lasts over 4 hours. Side effects continued. For Eleptro, common side effects are drowsiness, constipation, headache, nausea, and dry mouth. Severe side effects include extreme mood swings, fainting, hallucinations, confusion, and tremor. For Deplin, common side effects include confusion, depression, gas, loss of appetite, and taste problems. Severe side effects include bronchospasm, swelling, burning, or tingling feeling. So this specific group of drugs do not fall within the class, but we've come up with some categories to put each drug in. So for Wellbutrin, Wellbutrin is a norepinephrine dopamine reuptake inhibitor. Remeron is an alpha-2 antagonist. Cerazone doesn't really fall under a specific class or category. Eleptro is a serotonin antagonist and reuptake inhibitor. And Deplin is almost like medical food, and it can be used to treat folate deficiency, but it's also used to treat psychological disorders like schizophrenia.
The mechanism of action for Wellbutrin is that it decreases reuptake of dopamine in the central nervous system. It also diminishes uptake of serotonin and norepinephrine. For Remeron, the mechanism of action is that it increases the effectiveness of norepinephrine and serotonin. For Cerazone, the mechanism of action is that it inhibits the neuronal uptake of serotonin and norepinephrine. It also antagonizes alpha-1 adrenergic receptors. For Eleptro, it alters the effects of serotonin in the central nervous system. And for Deplin, it enhances therapeutic effects of other antidepressants. Disorders treated with this class of meds, they're all mainly for major depressive disorder, but Wellbutrin also helps with seasonal affective disorder, anxiety associated with depression and bipolar depression, and Deplin treats schizophrenia as well as major depressive disorder. So, ways to remember drugs in this class. None of these drugs fit into other categories with other antidepressants, so they're not TCA, MAOI, SSRI, or SNRI. So that's one way. Another way is that they are really commonly used to treat depression and they work really well. And lastly, they have a lot of the same side effects, so that could help for you to remember them. So we used our Davis Drug Guide for all of this information.
Thanks for listening!